Hi, I'm Cody Barnett with Bodyworks Physical Therapy in Wichita, Kansas, and I'd like to visit with you a little bit about foot pain and custom foot orthotics. And we see a lot of different foot problems here in the office, and there's a wide range of problems that people can present with. Probably the most common is something called plantar fasciitis. Now, you might have heard of this before. The plantar fascia is on the bottom of the foot, and typically people will get pain in the bottom of the heel, usually when they get up out of bed and go to walk in the morning, or maybe at the end of the day when you've been on your feet for a long period of time. So that's a common issue that we see. We also see something called metatarsalgia, which is pain on the bottoms of the balls of your foot. Again, that's typically worse when you've been on your feet for a long period of time. And then we also treat shin splints, and shin splints is a form of tendonitis that can occur either on the inside of the shin or on the outside of the shin, depending on the person's type of foot mechanics that they have. So one of the things that can commonly be helpful for treating all of these problems is using something called a custom foot orthotic. And a custom foot orthotic is a biomechanical way to help a person's foot problem and foot issues based on trying to adapt to their specific mechanics. We use what I feel is the best laboratory in America to make our foot orthotics, and with that we have cutting-edge materials such as carbon graphite and newer types of plastics that are being developed that we can use to help the person's problem. This is a common form of orthotic that we might use. This is made out of a carbon graphite material. When we fabricate those, the way we do that is we take a scan of the patient's foot, and what we do is we use a three-dimensional laser to scan the person's foot and to make a three-dimensional map of that. And so what we do, we have our foot here that we're going to use, our patient, and we're going to set that on the scanner like so, and this will then scan the person's foot, give us a three-dimensional map. And then once we have that three-dimensional map, what we do is we take a look at that, and that gives us the photograph, if you will, or the three-dimensional details of that person's foot. It's very important that when we do this, that we do it in a position that we call non-weight bearing, which means the person is not bearing weight or standing on the foot when we take that impression or take that scan. Based on that, then we electronically send this to our laboratory that we use, and they fabricate the device based on the specifications that we've provided for them based on the person's problem. If you'd like to learn more, we do have a medical library, and I'd encourage you to visit that at our website. We also have a library on our Facebook page as well if you want to check that out. And if you'd like to schedule with us, feel free to give us a call at 316-558-8808. If you don't happen to live in the Wichita area, I'd encourage you to go to moveforwardpt.com, and you can find a practitioner close by where you live. In the meantime, we appreciate your time, thank you, and I hope to see you soon.